Hi, everybody. This is Mark Graben from KaiNexus, and today we're doing a quick preview of our next webinar. It's going to be held on September 10th at 1 o'clock Eastern, and the title of the webinar is From Ambivalence to Action, Leadership Lessons from Motivational Interviewing. And if you would like to register for that, you can go to www.kainexus.com/webinars. And if you're hearing this podcast after September 10th, you can go to that same page and you can look for the recorded webinar library where the recording of this session will be for you to watch. And we'll also put the full audio of the presentation here in the podcast feed. But we're joined today by the presenter of the webinar, Mark Valenti, and we're going to talk a little bit here as a preview. Mark, how are you today?
Great, Mark. I'm doing really well. How are you?
I'm doing well. I'm excited about the webinar. I've been really interested in motivational interviewing, and you've been really helpful to me and helping me learn and sort of mentoring me with some of my understanding. So I'm always excited about the webinars, but I'm super psyched about this one. Can you give the listeners a little bit of a background about yourself and your professional background?
Yeah, thanks, Mark. I appreciate that introduction on this. And I personally have been intrinsically motivated, to use that term, which we'll talk about, of course, more on the webinar, and then helping sort of spread the word about this. And I appreciate the opportunity to do that. My background is very varied, let's just say. Behavioral health, working in Western Pennsylvania, Western Psychiatric Institute and Clinic on the outpatient side, but also in practice management and in operations. So it really gave me a chance to sort of mesh a behavioral health, behavioral change background that I saw on more of a clinical side with employees and team members. And how does the same sort of philosophy and strategies we use for one group, patients and families and community, apply to the people we work with every day? So my interest in this is really just how do we help activate people to reach the goals that they set for themselves, and that's part of what I want to talk about when we do our webinar.
Yeah, and I think that sounds like a really good description of leadership to help activate people and to be a helping leader. And there's going to be, as you said, a lot covered in the webinar. But again, to serve as a little bit more of an introduction, a lot of listeners might not know what motivational interviewing is. If you can touch on that, maybe also touch on like the word ambivalence in the title, From Ambivalence to Action. There's sort of a particular meaning of that word, and then maybe also talk about what is the connection in this methodology to what we do as leaders?
Yeah, that's a great way to frame this. Motivational interviewing is something, especially in the last few years, that has really been almost a buzz phrase. A lot of people kind of throw it around in, not only healthcare, but in a lot of different areas, everyone from sales, just process in general. And motivational interviewing is something that's often misunderstood. People say things like, well, is that really how you interview people for jobs? Which is behavioral-based interviewing, right? That comes up a lot, actually, for people that may not know. There's also people that say, especially in the healthcare field, who say, you know what, I don't really have time to talk with people and do quote-unquote therapy with them. I don't have time to talk with patients about how they feel. So motivational interviewing, quite simply, is how do you help people change their behavior? It's helping people change. And it's really an opportunity to connect your goals as a healthcare practitioner or a manager with the goals of the person that you're connecting with, and how do you find some mutually agreeable partnership on moving both goals forward. And motivational interviewing is truly pulling out that intrinsic motivation from whether the patient or the team member, as you talked about on a non-clinical side. And that word ambivalence, as you mentioned, is really about being a human being, how we are every day faced with countless decisions on whether I, eat this apple or whether I eat this donut, whether I take this long way to work so I'm less likely to get there when the boss gets there, or whether I get there super early to try to hide out. So in both those examples, it's people making decisions and deciding, do they want to sustain a behavior or do they want to change? And that ambivalence is really a complex human approach, and motivational interviewing is helping people work through their own ambivalence.
And we'll hear more about that in the webinar. Again, that's going to be held September 10th. Will be the live session, 1 o'clock Eastern. If you missed the live session or you can't attend it, please go ahead and register. You'll receive a link to the recording page. Or if you're listening to this and you haven't registered and it's after September 10th, again, you can go to kinexus.com/webinars and look for the on-demand library. Is there anything else that you'd want to add here just in terms of introductions and preview, Mark?
You know what, I think this was a great overview, and I think it's a good opportunity to sort of get people hopefully interested to kind of hear more about what does it take to help people work through a lot of the complicated changes in their lives. So thanks for that opportunity.
Well, sure. And thank you for making the time to do the webinar. I appreciate your intrinsic motivation because we're not paying you to do this.
That's fair. You're not supposed to tell everybody that, but yes, you are right. Intrinsic motivation is the key here.
I feel like no, I feel like we're taking advantage of you, but no, I think it's a good. But thank you for partnering on the webinar.
Sure.
The other thing I'd scribbled down here, just you talk about confusion. People might also think of motivational speaking, and this is not about learning how to be like some sort of forceful, charismatic speaker to help your employees do what you want them to do. That's not what this is at all, right?
Great point. We're not trying to turn people into Tony Robbins and be out there and speak in front of everybody. I agree. Good point.
So we're tapping into intrinsic motivation instead of trying to be better at externally motivating people, right?
Great point.
Yeah. Well, so again, as we wrap up here, we've been joined today by Mark Valenti, who's going to be our presenter for the webinar September 10th, From Ambivalence to Action, Leadership Lessons from Motivational Interviewing. Mark, thank you thank you in advance for doing the webinar, and thanks for joining us today to do the preview.
It's my pleasure, Mark. Thank you.